Hello there, my name is Dr. Leah Douglas, and today I'm going to talk to you about some newborn essentials. I'll give you tips on caring for your new baby and also go through what to expect with your new little one. Before we get started, I'd like to give you a little information so you can get to know me. I practice at the Children's Hospital location at Audubon. I am board certified by the American Academy of Pediatrics, and I'm a member of the American Medical Association. My clinical interests include preventative medicine and promoting vaccine safety and efficacy. And in my spare time, I do love to rescue animals. I'm the proud mom to 4 fur babies. I enjoy traveling internationally and experiencing different cultures. You will always find me with a few books on my nightstand. And every Sunday, you can find me either in the Superdome or in front of the TV cheering on my New Orleans Saints. Who dat? So I'd like to start with just a rundown of what we're going to talk about today. We'll go through what's going to happen in the hospital after your baby is born. Then we'll review some normal newborn behavior and habits. Followed by, we'll discuss feeding your newborn, as well as bathing, diapering, and dressing the new baby. We're also going to talk about newborn health and the first pediatrician visits. And then lastly, we'll review some newborn safety tips. So once the baby is born, there's going to be lots of new things happening in the hospital. So I'd like to review some of those things with you so that they don't come as a surprise. So immediately after the baby is born, the nurse will take your baby and will warm and dry the baby, suction any extra amniotic fluid from the baby's nose or mouth. Then they'll proceed to assess how the baby looks overall, and they do that by giving them what we call APGAR scores. They'll take a weight on the baby, which I know you guys will be excited to learn. Then they'll also measure the length and the head circumference. There's a few procedures that will happen shortly after birth. The nurses will apply an antibiotic eye ointment to the baby's eyes to prevent infection. The baby will also get a shot of vitamin K, which is done to prevent bleeding in the newborn. Also, during your hospital stay, the baby will get first vaccine, which is against hepatitis B. The baby will also get hearing tested in both ears. They'll also check oxygen levels in both sides of the baby's extremities, and this is to check for congenital heart disease. The baby will also get their blood drawn. Usually this is done through a heel stick, and they'll send that blood to check for a bilirubin level, which we'll talk a little bit more about later, and they'll send it for a state newborn screen, also known as a PKU. And then lastly, if you do have a little boy and wish for him to be circumcised, if this is cleared by your doctor, then your little boy can be circumcised before you go home. So now we're going to talk about newborn behavior and habits. So some things that you can expect once your baby has arrived, how they will behave. So newborns sleep a lot. Most babies sleep in short stretches, usually about 1 to 3 hours at a time. However, over the total day, they can sleep as much as 16 to 18 hours. Most babies do not sleep through the night until they're several months of age. And this is because they get hungry every few hours and need to wake up to be fed. Babies do need their own sleep space. This is very important, and we'll go through that more when we talk about newborn safety. They should always be placed on their back to sleep. And it is recommended that the baby share a room with the parents. And this is because it's easier to keep an eye on the baby. It's also easier to feed and comfort the baby and make sure everything is okay. Let's also talk a little bit about crying. So babies do cry. It's a very normal, instinctual behavior, and babies cry to communicate with us. Because they lack language skills, it's their way to tell us that they're hungry, or that their diaper needs to be changed, or that they're a little cold and need to be snuggled, or that they're sleepy. So it's important to listen to your baby's cues and try and respond accordingly. The next thing we're going to talk about is feeding your newborn. So we'll go through the ins and outs of breastfeeding and formula feeding. So if you choose to breastfeed your baby, that's wonderful. Breast milk really has the ideal nutrition for infants with just the right makeup of vitamins, proteins, and fat to meet the baby's daily needs. It's also great because it encourages bonding with the mother. And also studies have shown that it can be really beneficial for baby's health. They can get fewer infections if they're breastfed. They have a lower risk of asthma and allergies later in life. And we also know that it reduces the risk of sudden infant death syndrome. So breastfeeding is beneficial not just for baby, but also for mom. So after birth, once you initiate the process of breastfeeding, it helps release a hormone called oxytocin, which helps the uterus contract and return to its normal size before birth, and it also reduces the risk of bleeding after birth. In addition, it can help mom out later on in life in that it lowers the risk of breast, ovarian cancer, and osteoporosis. Other great benefits of breastfeeding for mom is that it saves money because you don't have to buy formula, and it also can help to burn extra calories so that you can get back to your pre-pregnancy weight quicker. Now let's talk a little bit more about how breastfeeding goes. So usually breastfeeding in the beginning will occur about 8 to 12 times in a 24-hour period. It's best to go off your baby's cues and feed your baby anytime he or she appears hungry. Some signs that they are hungry is that they may smack their lips. They may do some sucking motions and make sucking noises. They'll root and turn their head to what they think could be the breast. They can draw their hands up to their mouth. And then if they get really hungry, they will also begin to cry. So certainly you should breastfeed on demand as your baby shows these cues and continue to nurse as long as the baby is actively sucking and swallowing. There are several different positions in which you can breastfeed. The lactation consultants in the hospital will help go through these with you to teach you the cradle position, the football position, and also the side lying position, so you can figure out what works best for feeding your baby. And then it's always important to remember the ABCs of breastfeeding. So A stands for awareness, and this is being aware of when your baby is hungry and looking out for those cues that we talked about. B stands for be patient. So you don't want to hurry yourself, and you don't want to hurry the baby either. Breastfeeding is a great bonding process, and it does take time, and there's a learning curve. So just remember to give yourself the time to make it happen. C is for comfort. And it's really important to be comfortable and relaxed during feeding. Make sure that you and the baby are in a position that are comfortable for both of you, and that will help make it easier to facilitate a good feeding and for your milk to flow better. And then always remember that lactation consultants are available not only while you're in the hospital, but they're also available once you've left the hospital. And if you don't already have their phone number, once you've been discharged, you can always reach out to your pediatrician who can help get you in touch with them. So now let's move on to formula feeding. So if you choose to formula feed, your baby may need fewer feedings than those that we talked about when babies are breastfed. Formula-fed babies in general usually feed about every 2 to 3 hours during the day. Formula can be great in that it allows the father and other family members to feed the baby so that they get the bonding experience as well. It is definitely important to know that you should carefully follow the directions on the formula label when you're preparing the formula so that you use the correct amount of powdered formula to water, or if you're using pre-mixed formula, to follow those instructions. Also, it's important to know that any extra formula that's not finished within 1 hour should be discarded, as it can go bad or grow bacteria. It is okay to prepare formula in advance and store it in the refrigerator for up to 24 hours for use. In general, most babies do prefer warmed bottles, and the best way to do this is to hold a bottle under warm running water or to heat the bottle in a pan of warm water. You should never microwave the bottle, as this can cause some areas of very hot milk. And it's always important to test the temperature of the formula on your wrist before giving it to the baby. So whether or not you're formula or breastfeeding, it is important to burp your baby. So they need to be burped during and after every feeding. And this helps to get rid of air bubbles that they've swallowed while they were sucking and feeding. It's always a good idea to use a burp cloth just to protect your clothing so you don't get too messy. In general, a gentle pat or rub on the back works. Sometimes it can take a few minutes for the baby to actually burp, and some do require a firmer pat to get their burps out. There are different positions for burping. Most commonly, you can burp the baby over your shoulder. You can put the baby face down in your lap to burp, or you can cradle the baby's chin while sitting up in your lap and burp in that position. Next, we're going to move on to bathing, diapering, and dressing your newborn. So, babies actually don't need a bath every single day. In general, two to three times a week is totally adequate. When you're going to bathe your baby, it's important to gather all your supplies beforehand. Make sure you have some mild baby soap, a washcloth, a warm towel, and certainly a clean diaper to put on your baby after the bath. When you're preparing the water, you want to make sure that the water is warm, generally around about 95 degrees Fahrenheit is best. And you always want to test the water before putting the baby in to make sure that it's not too hot. It's a good idea to kind of gently sponge bathe the baby, and you can use a washcloth to help do so. And before the baby gets their first bath in a tub, we need to make sure that their umbilical stump has dried up and fallen off first. And until then, you can just use a washcloth with some water to clean your baby as needed. Bath time is great in that it can help baby bond with parents. It's also a very soothing time for baby and can help to relax them before sleep. So, in addition to bathing, let's talk about skin and nail care. So, babies very often can develop different rashes, and one of the most common things we see is baby acne. This can usually appear in the first few weeks of life, and it can last until about 3 months of age. Other things you might notice are cradle cap or scales on the scalp, and this is also common and normal. We get lots of questions about how to care for your baby's nails. You can use an emery board or baby nail clippers, and it's always a good thing to try and cut the nails when your baby is sleeping or to have someone else's help in doing so. Now let's talk about diapering your baby. So you should always wash your hands well, both before and after each diaper change. You want to make sure that you have a nice flat surface, either on the floor or on a changing table with side rails so that the baby can't roll off or be injured. And definitely make sure you keep one hand on the baby at all times. Make sure you're prepared before the change with any diaper creams, wipes, and clean diapers so that you don't have to reach away from baby during the change. You want to open the diaper and then wipe the diaper area with either a warm, clean, wet washcloth or a non-perfumed wipe, and then allow the baby to air dry before you put on the new diaper. For girls, it's a great tip to always remember to wipe from front to back and never back to front, and to also gently clean between the folds of the labia. For boys, it's a great tip to always ensure that the penis is pointing downward before closing the diaper, as this can help to avoid any leaks. So after you're all clean and diapered, now let's talk about dressing the newborn. It's important to choose soft and comfortable clothing, and also a good idea to remember that premature and small babies often need an extra layer of clothing or a blanket until they've reached a full-term baby's weight. When dressing your baby, it's always important to do so in a safe, flat space, and you always want to support the baby's head and protect his or her face when you're pulling the clothes over the head. You can definitely swaddle your baby with a blanket, and many babies find this very soothing. You can swaddle up until about 2 months, after which time it's not safe because babies will start to try and roll. Now let's talk about the health of your newborn and what the first few pediatrician visits will be like. So your newborn, once discharged from the hospital, will still have their umbilical stump attached. It's important to keep that stump very clean and dry. So we talked about not doing a first tub bath or submerging in water and just sponge bathing until then. It's a good idea to roll or fold down the diaper to avoid irritating the umbilical stump. And if the area does get soiled or looks dirty, it is okay to use a cotton swab or Q-tip dabbed with alcohol and clean right around the base of the cord. If you do notice any redness or swelling around the umbilical stump, if you notice a foul odor coming from the area, or any bleeding or discharge, then it is important to notify your pediatrician. So the next thing we'll talk about is jaundice. So jaundice is very common, and it actually occurs in a little over half of full-term babies and almost 80% of premature babies. So jaundice is actually caused by excess levels of bilirubin in the bloodstream. And bilirubin is an enzyme that is produced from the breakdown of red blood cells. It can cause the baby's eyes and skin to appear yellowish in color. And generally it usually develops a few days after birth and can last about 7 to 10 days, although some cases are longer, especially with premature babies. So your baby's bilirubin level will be checked in general at 24 hours of life in the hospital, and your pediatrician will definitely assess for jaundice again at your baby's first visit. High levels of bilirubin or some serious cases of jaundice may require that your baby go under a bilirubin light while they're in the hospital. So we mentioned before that if you have a little boy, you'll make the choice of whether or not you would like to have your baby circumcised. So benefits to circumcisions for males are that it does lower the risk of urinary tract infections and also other sexually transmitted infections later on in life. It does lower the risk of cancer of the penis and also the risk of foreskin infections and irritation. It also allows for better hygiene as you don't have to pull back the foreskin and clean. Certainly there are risks of circumcision. These in general are rare and minor, and that's usually some bleeding after the procedure, a skin infection, or if the circumcision heals improperly. In rare cases, it can later cause issues with urination, which would need to be evaluated by your urologist. If you do choose to have your baby circumcised, it in general will be done in the hospital, and it heals up in about 7 to 10 days. You'll want to make sure when you change the diaper that you keep your baby's penis clean and dry, and of course you can use gentle soap and warm water to clean at bath time. You should allow the penis to dry on its own to prevent any irritation and avoid tub baths until that circumcision is healed, as well as obviously avoiding tub baths until the umbilical stump has healed. And you'll be instructed to either smear petroleum jelly or A&D ointment on the tip of the penis with every diaper change until the circumcision is healed. And this is done to prevent the diaper from sticking to the area. So your baby's first pediatrician visit in general will be about 2 to 4 days after birth. Once you're discharged from the hospital, the doctor will let you know when your baby should be seen for their first appointment. Most of us pediatricians have special time slots dedicated just to newborns, so we can avoid exposure to other sick patients and see them when we're only seeing other well patients. It's a good idea to bring someone to support you at that first visit, your partner or another family member to help you get your baby inside for their first visit. You also want to make sure to bring your insurance card and also any important discharge documents that they gave you at the hospital. And this will allow your pediatrician to review all your baby's birth information at their first visit. You can also expect for your baby to be undressed down to the diaper and then have a weight, length, and head circumference to be checked. And of course, your pediatrician will examine your baby from head to toe. Your pediatrician will go through all of your baby's habits. You'll talk about feeding patterns, sleeping patterns, and then also go review how many wet and dirty diapers your baby's having each day. Your pediatrician will also discuss recommendations for vaccines and talk to you about when to follow up and what to expect. The routine checkups during the first year after the first newborn visit is 2 weeks of life, 1 month of life, 2-month checkup with vaccines, 4-month checkup with vaccines, 6-month checkup with vaccines, a 9-month checkup, and a 12-month checkup with vaccines. Of course, your pediatrician is always available to you in between those visits if your baby is sick or if you have any questions or concerns. Lastly, let's talk about newborn safety and tips on how to keep your newborn safe and well. First, let's go through car safety. So you want to have a car seat for your baby. It should be a rear-facing car seat with a 5-point harness. And your baby should stay rear-facing with that 5-point harness until they're at least 24 months of age. You definitely want to make sure that you know the history of the car seat if it's previously owned, and make sure that it's in good functional condition. It's a good idea to install the car seat and check it before your due date because we don't always know when baby's going to arrive. And in general, the middle back seat position is the safest location for the car seat. It's also important once your baby is born to make sure you never leave the baby alone in the car. It's also a good idea to leave an important item in the back seat like a purse or cell phone as a reminder to check that seat when you exit the car so as not to leave the baby in there. Now let's talk about sudden infant death syndrome. So there are some ways to prevent this, some very easy things to do that you should keep in mind. Always place your baby on his or her back to sleep and make sure that the baby is in a safe sleep space. A safe sleep space is a flat surface where a baby cannot roll off, and also you should not co-sleep with your baby, so the baby should not be in the bed with you. In the beginning, a bassinet or crib is a great place for the baby. You want to make sure the baby is not sleeping in a rock and play, and again, not in the bed with you. You can use a firm mattress and make sure not to put anything in the crib or bassinet with the baby. So that includes no toys, no bumpers, and no blankets. Only if the baby is swaddled up until about 2 months is the blanket okay. You should definitely make sure not to smoke around the baby, as this increases the risk of sudden infant death, and also don't allow your baby to overheat. Some other important safety tips: make sure you always support your baby's head. Their neck muscles aren't as well developed, and so they can't support it for themselves. Make sure and always wash your hands. Use good hand hygienes before touching your baby and after changing diapers. When it comes to all of your newborn gear, you want to make sure you use safety straps on all equipment and make sure everything is installed and assembled properly. And then, of course, you never want to leave your baby alone. The baby should always be with an adult and supervised, and you should never shake your baby. It has been such a pleasure to talk to you guys today. It's such an exciting time to welcome a new baby into your family. And I thank you for listening to me, and congratulations, and enjoy this special time.